We are here with Dr. Lopper, and Dr. Lopper, you're going to be talking about understanding and managing TMJ disorders, and maybe for my benefit, maybe for those watching, what is TMJ disorder to begin with?
That's a good question. Good question. So TMJ stands for temporomandibular joint, and that is the joint that is right here. It connects your mandible, your jawbone, to your skull. And it's a very complicated joint. It gets a lot of use in chewing and grinding and talking. It's always in motion, and we tend to see a lot of problems with that joint. Pain, unusual sounds, clicking, that can lead into headaches, migraines, and just can be really disruptive to your lifestyle if you start having problems with that joint. So there are ways that we can kind of help treat those problems and also prevent those problems.
So if I notice some clicking or something, and I'm sitting in your chair, I say, hey, by the way, while you're cleaning my teeth, I've been hearing this clicking. Is that how folks generally tend to realize something is wrong to begin with?
Yeah. They hear something funny, or they feel something funny, or the most common thing that I really see from these sort of disorders is headaches. People get frequent headaches, and most people don't realize that one of the most common causes of frequent headaches in this region here is from bruxism and grinding your teeth, and that puts a lot of strain on your joints and the muscles in that area and can cause headaches. And we can make appliances. We make a bite splint, so it's just a little custom-made piece that we can control the way that you bring your teeth together and reduce the stress on the joints and the muscles, and very effective in reducing headaches and reducing the tension on the joints, and in general, very effective overall in making you more comfortable when you have those sort of disorders.
And is that something you wear at night when you sleep, or is there anything you wear during the day as well, or this is just nighttime appliance?
That's a good question. Most of the problems we see are initiated by nocturnal bruxism, which is where people are grinding or clenching their teeth at night, and so most of the time you get the best benefit from wearing it at night. But I do have some patients that wear it during the day if they feel like they're clenching their teeth while they're driving or working or that sort of thing. So. But yeah, they're very easy to use and very comfortable. And once we find that ideal position, most people actually don't want to go without it. So they're very effective.
And can I ask, so if somebody's going to get this done, you mentioned finding the ideal position. How do you do that? Does that happen in the chair and you're having a bite down and just?
Yes, all the above. Yes, we test their bite. We test the jaw position. We test the way that the jaw moves and the joint moves, and generally we can find kind of that comfortable position where we're reducing the strain on the muscles and the joints as much as possible.
And can I ask, are there any any particular success stories? I mean, is there anybody in particular who stands out, who was really having a problem that you solved for them? Yeah,
I have a lot of them. One patient in particular that came to me, and she just was having terrible headaches. She went to the doctor. She had CAT scans. She had every test you can think of, and they couldn't find anything. And she came and saw me as a last resort. And we tested her bite and her jaws, and ended up making a custom bite splint, which is basically kind of an orthotic for your teeth and your jaws. And within a matter of days, her headaches went away. And so it's just those kind of success stories that are rewarding. And it's just amazing how just a simple little appliance, when constructed properly, can just make a huge difference, not just with your teeth or your jaws, but with your life, with your overall lifestyle.
And the key there is constructed properly, and that's what you guys know how to do there at Coshocton Dentistry. And if you've got headaches, maybe it's just not the traffic you're dealing with that's giving you the headache. Maybe it's a little bit of your TMJ disorder, which you learn something new every day. TMJ is a new thing, but if you do have those headaches, hey, maybe that's the problem. Coshocton Dentistry can help you. CoshoctonDentistry.com. Check it out, and thanks for watching.